Welcome, everyone. Five Wishes is pleased to present today's webinar, Shifting Your Advanced Care Planning Activities During COVID-19 and Beyond. My name is Jennifer, and it's my pleasure to facilitate. We are recording the call, and we did mute all participant lines. If you need help, please email 5wishes@compartners.com, or you can send us a message in the chat box. If you're listening over the phone and you need help, please press *0 for the operator. The presentation will last up to 60 minutes, and you are encouraged to ask questions throughout. Please submit your question by typing it into the chat box in the lower left corner of the screen, and then do be sure to click the send button. Please take a look at the links box, also on the left side above the chat area. Here you can find a resource to view. Simply click on the link and a separate window will open. This will not interfere with your viewing of the program. It's now my pleasure to introduce Paul Malley. Paul is the president of Aging with Dignity, a position he's held for 18 years. With more than 20 years of experience in the field of aging and advanced care planning, Paul is a national expert, frequent speaker, and advocate for quality and dignified care at the end of life. Paul, welcome. I'll turn it over to you.
Thanks very much, Jennifer, and hello. Welcome to everyone who's joining us. It is always good to have our Five Wishes practice community together again, and we're grateful to everyone who's made time today to be a part of this conversation. First, a sincere thank you for all that you have done and the challenges you've overcome over these past few months. We know we've heard from you. We know you've adapted to a significant amount of change, all while doing your absolute best to take good care of the people around you. That includes your patients and members of your team, or in a lot of cases, both. So as always, but especially right now, we appreciate and honor the work that you're doing in the world and for the people around you. And we're really grateful for you for keeping in touch with us during these times to let us know how you're doing. And we want to keep hearing from you. In fact, a lot of the ideas that you'll hear today come from the challenges that we've heard from you and some of the innovations that we've devised along with you in response to those challenges. We chose today's topic, Shifting Your Advanced Care Planning Activities During COVID-19 and Beyond, based on those things that we've heard from you. You've told us about some of your challenges brought on by the pandemic and how you're addressing them. And many of you have been finding solutions to these challenges in partnership with us at Five Wishes, which has been really wonderful. And that's really the important element of this practice community, working to get together to create tools, resources, processes that foster high-quality advanced care planning. And by now you've heard us say, maybe a few times if you're joining us for the second or third time or hearing us for the first time, that the goal of this community is to enhance your outcomes and elevate your practice through sharing best practice stories, resources, and information. So every time we learn about a challenge that you've faced and work together to find solutions, we gain that valuable insight that can help other providers, everyone joining on this call from all parts of the country today and afterward. That's the strength of the practice community. When it comes to Five Wishes, one of the things that Five Wishes has always been about and focused on is asking people what matters most and how we can help them to achieve it when we think of patients and families. And it's the Five Wishes practice community operating on that same principle of finding out from you as healthcare providers what matters most to you. And I want you to keep in mind that we remain open and available to try and address any and all issues specific to your practice. No two are the same, just like no two people are the same. So we really love hearing from you both what works and what's challenging, and to create some custom solutions with you. Kathleen Taylor is going to walk us through the next steps of this discussion. And Kathleen is our Five Wishes healthcare advisor. She's been working in healthcare for over 30 years. She has a great passion to improve the healthcare experience for people who are sick and vulnerable, and to help healthcare professionals find joy in practice through cultivating empathy and communicating compassionately. So her mission jives well with our mission, which is ultimately in support of your mission. So with that, I'll turn it over to Kathleen. Kathleen, thanks for being with us today.
Thanks, Paul. Thanks for the introduction, and thanks everybody for being with us. I'm going to get right into it. The focus for our time together today is to explore the challenges and opportunities for advanced care planning, or ACP, you might see in some of the next slides, in the current healthcare environment, and review simple, achievable ways that you can adjust your advanced care planning activities so that conversations continue to be timely, effective, and cover what matters most. I want to remind you, as we go through the content today, please ask your questions and share your ideas in the chat box, and remember to hit send. We're going to be talking about new challenges and some new ways of doing things, and as Paul said, if you have a particular or specific challenge or something that you want to try to solve one, let us know your ideas about that as we go through. And again, put that in the chat box. Even if it's something that we don't talk about out loud today on the webinar and we don't cover, we'll get a record of all of the input after the webinar, and we can follow up with you individually if it's something that seems like, maybe we should get in touch and work together on something to solve an issue. So keep that in mind. So I think we all know that every day for almost 7 months now, the headlines have been about the coronavirus pandemic, COVID-19 infection rates, and death totals. You really just can't get away from it. Everyone is paying attention to the daily numbers, although we're a little fatigued by them at this point. And there are reopening debates and changing guidelines, and still people's daily lives are affected by the pandemic. We're in a time when everyone is aware of the possibility of mortality, that of themselves and that of those people that they care about. And for months now, we've seen headlines aimed at the public about the importance of considering advanced care planning in light of the pandemic. And the public is ready to talk. When this all started, Five Wishes had about a 10-fold increase in requests from individuals, not healthcare practices, but from the public for advanced directive forms around the end of March. So here's what's interesting. Despite this peak, this crescendo in public awareness, the feedback that we're getting from our healthcare partners is that there's actually less advanced care planning activity going on. And we know that this is certainly due to the challenges that the pandemic has brought to healthcare practices that are affecting advanced care planning. So we're going to run through some of those today just to kind of get a picture of where we're starting from. And that's also why today we're going to talk about how to find some really simple and sometimes subtle tweaks to keep your advanced care activities going and make sure that you can continue to provide this really crucial service to those that you care for, even in the context of these challenges. So what are the challenges? Lots of them have been brought on by safety concerns. The concerns about spreading the virus and maintaining safety have been shared by providers and the public. And people have postponed or delayed their medical care. There was a Kaiser Family Foundation tracking poll in May that found that 48% of people who responded to the poll said that they or a family member had skipped or postponed medical care in the last 3 months due to COVID-19 concerns. I did too. And I think most of the people I know, we kind of didn't go to our regular appointments because everyone was talking about the danger of going into a waiting room. Many restrictions and policies are still in place for hospitals and health systems to ensure public health. In some states, the restrictions have been lightened and then they've been reimposed after new increases in COVID infection rates. There have been moratoriums at one point or another on non-emergency care. Some of them have been eased, but for months, because of these new restrictions and reduced demand, there was a huge decline in outpatient visits, anywhere from 60 to 75%, depending on which study you read. And there was a similar decline of around 50% in emergency department visits. For a while, some states were, and some still are, limiting hospital volume by requiring hospitals to maintain a certain number of vacant beds. And this is to help accommodate as they are redeploying staff and shifting the focus of units to take care of patients that need taken care of. So with limited in-person opportunities, practices haven't had the usual interactions to physically distribute as many advanced care planning materials to patients and families as usual. And of course, community events in the traditional sense and in-person referral outreach visits and activities have not been happening. Of course, the result of this dramatic slowdown in volume of patients is a drastic loss of revenue, and I'm not laughing at that. It's just the amount of lost revenue is something that takes my breath away. The American Hospital Association issued a report that estimates hospitals lost $202.6 billion. I'm saying that is a word with a B on the front. $202.6 billion in revenue between March and June of 2020. And they anticipate another $120 billion in lost revenue in July through December. So this is, I know unprecedented has been the word of 2020. That's unprecedented. Now, the expansion of telehealth and some payment for telehealth by Medicare and other payers has helped practices maintain or regain some elements of care delivery and provided some revenue stream, but it has not at all made up for the loss of in-person visits. And to address financial impacts, there have been reductions in the workforce, furloughs, and some of you have experienced those, and many private practices and smaller clinics have already been consolidated or sold or closed. And we don't know if those are coming back. So all of these factors have affected advanced care planning activities in that there are less opportunities for in-person advanced care planning conversations during outpatient visits, which is how we're used to having them. Fewer of the usual staff who have owned having advanced care planning conversations there are available. So there's fewer people that we're used to available to have the conversations because of workforce reductions in non-critical care areas and also because of increased caseload demands. And as units have been converted to accommodate patient loads, redeployed staff who came from other areas can feel unprepared for having advanced care planning conversations in critical care settings. So that's a training challenge there. Practices have, in many cases, interrupted their usual workflows and processes that they use for identifying patients in need of advanced care planning conversations. And with in-person restrictions, the usual step of documenting advanced care planning with signed advance directive documents is a little different. So all of this is kind of the way we have usually done it and the way we got good at doing it. We're having trouble doing it that way anymore. So with all of that said, and with all the changes in practice and the redeployment of staff, advanced care planning activities have, it seems like, gotten a little lost in the shuffle in some cases. And I think that's because, first of all, you know, it's perfectly understandable that they would fall off the radar. But it's also because I think that healthcare practices and systems don't often connect advanced care planning with their top line organizational goals, or with their emerging organizational goals, or with their emerging organizational crises. But we're going to talk a little bit about how they are connected. Right now we have several factors that are making advanced care planning more important than ever to address with everyone. As I already mentioned, this is a critical time of heightened awareness, as advanced care planning it's top of mind for many people and has become immediately relevant to everyone. So we don't have to do lots of awareness work right now. It's already happened just because of the circumstances. There's also a clinical need for advanced care planning now. There are people in our care who are truly at high risk for COVID-19 complications, who have those underlying issues, and they're going to need these decisions to be made. So there's a clinical need. And of course, families and frontline providers don't want to make decisions without knowing what someone would want. Advanced care planning can provide some relief from that kind of decisional burden and the chaotic confusion that can surround real-time crisis decisions. At a time when practices are struggling with financial issues, remember that advanced care planning has an impact on both quality and cost, and we'll talk a little bit more about that on the next slide. And it can improve communication, which is tied in with HCAHPS measures and reimbursement, and helps to ensure patient-centered care choices, which we know we're all measured on, and informed decision-making. So the well-researched and documented benefits of advanced care planning in general are increasingly relevant in the context of COVID-19. And just to review some of them, we all know that advanced care planning improves these outcomes. Likelihood of complying with documented wishes. And again, a documented wish is what this person wants or does not want. Decreased likelihood of, again, unwanted intensive treatment. Increased enrollment in hospice care, which we know is good in a variety of ways. And increased likelihood of the person dying in the setting of their choice. So it also improves patient and family satisfaction with care. It also reduces complicated grief measures and decision burden for families, reduces provider stress. It helps us to more properly use pulsed medical orders because there's a population those are appropriate for, and there's a population they're not appropriate for. So all of these benefits have associated decreases in costs, and it's tricky to talk about costs in advanced care planning because reducing cost is not the main reason we do it. It's not even a top-line reason that we do it. We do it to ensure that we provide care that's aligned with someone's wishes. But here's the thing. When we do align care with wishes, what happens is that we reduce unwanted utilization costs. Advanced care planning reveals if these interventions align with a person's wishes and if the benefits of these interventions will outweigh the burdens for this specific person. So they reveal what's unwanted, and that ends up being how side benefit, it reduces costs. So we've got lots and lots of research that consistently shows that healthcare utilization drops significantly with good advanced care planning due to reducing the number of hospital admits, reducing the length of inpatient stays, which people don't want either of these things, reducing readmissions, and reducing the intensity of treatment at the end of life. So if these outcomes and these benefits occur when advanced care planning is done well, let's just quickly review what doing it well means. The benefits are somewhat dependent on a few competencies in advanced care planning. So we want to make sure that it's ongoing. It includes exploration and discussion of goals, values, and a person's understanding of their health and how that affects decisions. That it's revisited whenever there are significant changes in circumstances, health, or wishes. And it includes documentation. And I want to call specific attention here at the bottom of this slide to some of these qualities. The most effective conversations, of course, they occur early and often. It's better if someone's been talking about this since they were healthy. But even if they haven't, we want to make sure that they explore understanding of the choices to be made, that they explore understanding of someone's condition, their current condition, and how that might affect the likelihood of certain complications and outcomes that are poor to them, and fears and concerns, and that they're focused on goals and values. So goals and values are what illuminate desired and undesired treatments and acceptable and unacceptable outcomes, and any information that we might be able to provide that's relevant to those. So given the current challenges and what we need to do to ensure we're continuing to do good advanced care planning, we're going to, as we said, just review some simple and subtle ways that we might shift advanced care planning activities in light of all of this. So one shift that seems probably to be the most obvious is in identifying patients. And we've heard from some of you that the usual workflows have been interrupted. So there was a process for triggering patients to have advanced care planning conversations with. You're not doing that process anymore, or it was too involved and there's no time to do that. You can probably simplify right now. Right now, in the current context, it is of most important to engage. It's most important to engage individuals who are at high risk of complications or poor outcomes from COVID-19. These would be the people that would be most beneficial to have advanced care planning conversations with anyway. So it's a good idea to engage them in the current circumstances. And that's anyone who's medically fragile and or over 65, although I've heard that age going down to 60 and sometimes 50. Anyone who's likely wanting and ready to talk anyway, I think is good to engage. Obviously, I think any residential patients who are full code, now's the time to discuss plans with them, given everything that's changed. And that's going to include your facility's capacity to care for COVID patients and what might happen if that happens. Having both goals of care conversations and advanced care planning conversations with those folks is really important right now. And we want you to encourage anybody that you serve to discuss their wishes and complete their documents. That's kind of as per usual, but we'll talk in a little bit about some easier ways to do that. And even though this is a good idea to do all the time, it's especially a good idea right now to review records and ensure that existing documentation is up to date. Because guess what? Stuff just changed. And now we have there's another consideration in advanced care planning, and it is COVID-19. So pretty much anyone who's got an advanced directive needs to revisit it at this point. Another shift to consider is in training. And I'm a huge advocate for really good and thorough training that addresses specific competencies. I'm never going to think that's a bad idea. If you can do it right now, please continue to do it. But the challenge we have is that we've got, first of all, some limited time and resources, and second of all, some redeployed staff who may be unprepared to have advanced care planning conversations in critical care settings, which is usually where they're getting redeployed to from those outpatient environments that don't have any traffic to the environments that do have traffic right now. Research has shown, and this happens over and over, that most clinicians don't feel adequately prepared to engage in advanced care planning conversations. And that didn't change because we have a pandemic. So you need some form of training to help your staff feel and be prepared and to be comfortable having conversations and eliciting values and decisions. But right now, with limited time and resources, you might be able to keep it a little bit more simple than you would if you had more of those things. So choose training options that provide frameworks and conversation prompts and scripting or suggested phrasing, because those can really help increase clinician comfort with initiating and facilitating conversations. I mean, if you give someone a map to follow, that makes it a lot easier to navigate the new terrain. And find training options, or make them, that emphasize the quality of the conversations. That part that's about getting to values and making sure the patient is empowered to understand the choices and have conversations with their family and loved ones, rather than training that focus on basic transactional stuff and processes. Quite frankly, people are always going to get that from, you know, the nurse or the doctor or the social worker next to them. If they're new to it, they can always ask for help with that. So make sure your training is focused on conversation quality and easy things people can lean on that will help them be more comfortable. You can use any training that works and meets your current needs. And we, of course, want to mention that Five Wishes has some training options that are simple and affordable and don't require taking staff out of rotation or out of the field. We've got 3 Five Wishes online modules. The great thing about them is that they're an hour each. They're all CE accredited, but they take an hour, and because they're on demand, it can be, you know, people can finish them at their own pace, a few minutes here and a few minutes there, as they want to. They all review a framework and suggested language and conversation skills and prompts. So they do those things we talked about, and they're incredibly inexpensive. So that's a good option. The conversation guide for clinicians is also a really good option. It's a booklet form that's wonderful as a just-in-time resource. So if someone new is going to have a conversation, you can literally kind of hand them this in the document, and they will be much better prepared than if they didn't have that. They can just kind of follow the conversation guide. And I want to make sure everyone knows we also we'll create custom training solutions in a variety of forms for whatever you're needing right now, because we know that's changing. Paul, I don't know if you have any thoughts about things we've created with partners to meet their individual needs, just so people understand the kinds of things we can do.
Sure. So just a couple ideas of things that have risen to the top in the past few months. Early in the spring and early summer, we had requests from several of our healthcare partners to present Five Wishes as part of a clinical team conference call. Back in the days when there were weekly calls that teams were participating in to stay up to date on all of the new information coming regarding COVID-19, they added a training element. And when I say element, I mean like a 10-minute discussion on Five Wishes and advanced care planning and how that system was using Five Wishes. So that was us working together with our healthcare partners to help the rest of the team understand the messaging related to advanced care planning as part of existing training schedules or calls. The second thing was creation of some custom webinars for a specific healthcare team, whether it was a geographically centered team in a state or spread out nationally. We were able to work with a few providers to create that customized webinar experience, usually an hour or less, for their providers to learn about how they could best use 5 Wishes within their system. And then the last thing is really helping all of your team to have some sort of personal experience with advanced care planning for themselves. One way to do that is through our workplace wellness program that we work with non-healthcare providers, employers of all different stripes and sizes and sectors. But one thing that we've often heard from our champions, the champions of advanced care planning working in healthcare, is that they often say, I feel like I'm a voice in the wilderness and I want more help from my team. And one of the best ways to do that is to give them some experience of using 5 Wishes with their own family, putting it into their hands, encouraging them to go home, talk with their spouse, their family about it, because if they have that experience, they will be a better part of your team, your army that's out there in conveying an important message to the people you serve. And the last thing is we've heard a few different health systems and hospice organizations in particular take the chance to educate their leadership team and their board or their community advisors on advanced care planning through a webinar or a conference call. Then their focus is not just on here's advanced care planning and how our system or our organization can help, but it's also raising awareness of what good hospice and palliative care are all about. It's a tangible expression to them of the good that you're doing, not just in advanced care planning, but in the care that you're providing in your community. So that's that double benefit.
That's great. Thank you. Yeah. And again, if you have ideas or a challenge you're trying to solve, just again, enter that in the chat box. And even if we don't get to cover it today, we will cover it and get back with you. All right. So that's some shifts in training and some ideas about training. And a couple of you have already made some comments that point to this shift with patient education and people still being resistant to talk about advanced care planning or not understanding the benefit, or people that may be reluctant. Patient education, I think, right now is maybe one of the most important shifts that we all need to make because there's a little less advanced care planning activity going on in practices. You ideally, you want to have materials that can stand alone and that are helpful if there is no facilitator or clinician to guide the conversation. Now, while that is not ideal, and we are not saying do that, it is reality. And the truth is, people have advanced care planning conversations all the time without a clinician there. So I think when folks have advanced illness, it's our responsibility to be part of those conversations and to facilitate them. But for folks who are healthy or only have mild conditions, they're probably having these conversations without you. Patient education is a really good way to ensure that that's happening and also to kind of break the ice for the people who we're more concerned about who do have conditions, and we need to ensure they're having conversations. So have materials that can stand alone, again, and to make sure they can stand alone, look for things that are simply worded resources that help explain what advanced care planning is and the role of the healthcare agent. Materials that provide prompts and encourage discussion about end-of-life values, experiences, and goals are very helpful. And some decision aids about life-sustaining treatments are also helpful, although you may not want to give that right at first. That might be something to give later on to folks who have questions about life-sustaining treatments. So one thing to remember with patient education materials is if people can't explain these things, if they can't have these conversations with their families and their loved ones and their kids, then it's defeating the purpose. That's the main objective. So materials that you have should empower and educate and prepare people to communicate with the stakeholders in their lives, who are their family and friends and loved ones and kids. Because really the only time decisions sort of get messed up is when we don't know them or someone objects to them. So keep that in mind with patient education materials. And again, I just want to mention a few things that we have that might be helpful to you. First of all, your advanced directive form is or should be, ideally, a patient education tool. So if you're using a less than friendly form, which the state forms often are, and I know some of you have to use that, have something else in addition to that. If you have to use state forms and things written in legalese, just have some other resources in addition to that. And again, make sure that they're clear and understandable and have simple instructions and can be used by people with a variety of literacy levels. You don't have to use 5 wishes, but use something that's easy to understand. The 5 wishes document is that. Sometimes people talk about the length of it, but what they forget is that you're not the target audience. The person completing it is the target audience. And it does stand alone. It's one of those things that, you know, if you had to, you really could hand it to someone and give them time, and they can go and have conversations with it. So that's part of why it looks lengthy to some people, but it's because it's covering everything that needs to be covered. We also have a great conversation guide for individuals and families that has step-by-step guidance on completing the 5 Wishes Advanced Directive, and it's got suggestions for people to talk with their doctor, suggested words and phrases. So you can use these tools or something else. There are plenty of good patient education tools available, and you can find any of them with a great Google search, but just make sure that you vet them. And make sure that you, I think it's a good idea to find some other folks that are using them and ask how that's going. That you know, and if you make up your own, be careful with that too. If someone's going to write it, make sure it's someone who can write this way. Another shift is in, for lack of a better word that I could come up with, it's distributing, actually getting documents and materials to people. So with this, you want to kind of weigh out costs and benefits of different approaches. There's ease of use and accessibility. I will tell you, and you may have found that this is true too, patients often prefer the paper versions of things. They prefer the physical paper 5 Wishes Advanced Directive document. And there's also a reliability to paper in that people tend to have their own copy more readily when it's paper as opposed to when it's online and stored somewhere. I don't know why that is, but it is. So consider those things, and also consider accessibility in terms of computer literacy and access to equipment and internet when you're thinking of electronic versions of forms and materials. There's also, with getting materials to folks, there's a cost to mailing that you want to weigh out versus some of the other things that we're talking. And there's ease of uploading documents into your health record. Scanning documents has that's old school, but it's still an option. It's always been an option when people bring their own advance directives and are admitted to care. They've always been scanned. So remember that if you got rid of that as an option, it's probably real easy to get it back as one. And then there's room for creativity right now with getting things to people. Paul, again, I know you did a really cool project about fulfillment with a physician group. So can you talk a little bit about that? Because again, it was another problem-solving caper for 5 wishes.
Yeah, it began with a head-scratch moment when we were talking with one of our partners, as you mentioned, a physician group, multi-state regional, so a large organization. They lost their fulfillment shop, and the mail houses that they had worked with locally were no longer able to provide their services, not only for advanced care planning, but just for getting welcome packets and other things into the hands of their patients. Their patients skewed older. They wanted material in their hands still to hold and to talk with their nurse, even if it was an in-house visit or a telehealth visit. So they came to us not expecting that we would solve this problem, but when they said, well, here's our challenge, we just can't get these things into people's hands, we said, well, we might be able to help with that. So we devised a way where our fulfillment shop for sending out 5 wishes to individuals or organizations, we could modify it and we could work directly with this physician group so that we could send the 5 wishes and the other material that they wanted directly to their patient and worked with them to create that process. That's not something that we would have set out to do on our own, but in talking with one of our partners, it was a way that we could help. And I think internally, to give you a little bit of a glimpse of our philosophy and what we try to do, we want to always be inclined to say yes, and to say if it's appropriate, we can do that. And I think that was one of those examples. And as well as creating other new digital solutions that are connected to 5 wishes. So for those health systems that wanted an option that was a fillable PDF or an online digital experience or coordinating with their EHR, in each of those cases, we heard a challenge, we worked with them to find a solution, and it was customized because there's no real way to put out a pathway or a flow of information and make it work in every system or physician practice or hospice. So what we love is that we really are able to hear what your specific challenges are and then bring some of the experience that we've had from others on this call and others that are part of this practice community and say, here's something that might work, and in the places where we can help, we're happy to do it and tell you.
Yeah, and thanks for that. This is the magic sauce that we're hoping to have more and more of with the practice community, is sharing the best practices and sharing the solutions that we've found. So we'd love it when you share them, and we will share them as well when you're not on the webinar. And Paul, you mentioned that there are solutions that are kind of born out of the current challenges, and one of them is something that is called 5 Wishes on Demand, which is a link to a fillable PDF version of 5 Wishes, and that can be emailed directly to your patient or linked from your website. And one thing that's great about that is it includes monthly reporting with utilization data. So it was a pretty quick and very custom solution created from somebody coming and saying, hey, we need a way to do this. And now it's just, that's one that is kind of relevant to a lot of people. A custom solution that has relevance for many, many, many other practices. So if you're interested in 5 Wishes on demand, contact Joanne, and we'll have her contact information on the last slide. Another area that we need to shift, and everyone pretty much already has, is the channel by which we are having advanced care planning conversations. So the challenge is, of course, there's less in-person opportunities, and what has happened is everyone has moved to telehealth, virtual, remote conversations. And I think that's one of the most significant changes that we've had. So fairly early on, CMS issued waivers that allowed for expanded use of telehealth for different types of visits, and they relaxed some HIPAA requirements. And they also now allow for payment for advanced care planning conversations using telephone. So most, if not all, of these changes that started as waivers are becoming permanent. We're not going back. Virtual visits, telephone visits, these are here to stay, even if and when the pandemic resolves. I just don't see that we're going back. So the more we can get creative with these and figure out ways to make them really work for everybody, especially for our patients and families, the better. I think telephone and virtual visits actually are great with advanced care planning because they do several things. They increase access. People don't really want right now to come into a medical setting for a conversation, so they don't have to. It creates a solution to a travel hurdle. If people didn't want to come all the way to somewhere, you can talk to them no matter where they are. And it creates a new care setting for conversation, which is their home or wherever they are. And that is more convenient and comfortable for patients to have a conversation when they're in their own home than it might be if they get white coat syndrome and are in a clinical setting. We did a webinar in May that there is a link to the archive of it on the Practice Community web page, which is in your links area here on this screen. You can view that anytime you want. It was all about telehealth and how to create presence through telehealth channels. So I encourage you to look at that if it's something that you're still getting comfortable with. So we've talked about getting people materials and educating them about this process and the channels by which we have conversations. And now I want to talk a little bit about how the actual conversations have shifted and need to shift in the context of this pandemic. There are some extra considerations. First, it's in bold, so I think you get the emphasis, is to encourage the designation of an informed healthcare agent, someone who's informed about what this person wants. The other big highlight, maybe I should have made this bold too, is that we know there are potential risk factors and complications from COVID-19 that are related to a person's health status and age. Those need to be part of the discussion. They just do. And assessing someone's understanding of that and their desire for further information is really important. So you want to provide information about likely treatments for people who become seriously ill from COVID-19, and that keeps changing. But whatever we're doing, talk about what's likely. And talk, of course, about how whatever their age and condition is going to influence the success of some of those treatments. That's important because it will affect decisions. And then reviewing options for caregiving and support if somebody who has an advanced illness doesn't want to go to the hospital. If they're saying that's not something I want to do, then this is kind of where there's an overlap between goals of care conversations and advanced care planning, but it's going to come up, so that's important to discuss. And remember to consider that advanced care planning always works best if you start the conversation by talking about values and concerns and fears and what matters and experiences they've had that they felt good with and ones that they felt bad with. It doesn't work well if you start out by asking people if they want CPR. So that's a little bit of what we talked about in the training, but that's really where we want to start with the conversation, is to ask what they understand about their condition and what they expect and their fears and hopes and what trade-offs they're willing to consider. And that will help deepen our understanding and make it personal. It's both easier to start the conversation that way, and it naturally leads people to their questions about treatments and complications and what they should know. So it's just a slight shift in some things that we should mention now. In addition to that, there's a lot of talk about COVID-19 addendums to advanced directives. And what I want to remind us of is that doesn't necessarily belong in an advanced directive. I'm not saying it's a great idea to have something like that, but that is a conversation that a person should have with their healthcare agent and with their provider. It's a good idea for it to be documented, but it's not an advanced directive. Advanced directives come into play when someone, A, cannot speak for themselves, and B, there is no hope of recovery. So we're at an end-of-life scenario. So COVID-19 isn't one of those until it is one of those. It's an acute condition until you're not going to recover from it. So the COVID addendum is really a conversation about critical care, not end-of-life care until it's end-of-life care. Now, if you've got somebody who's got an advanced condition, an end-of-life condition, that's different. That's directly relevant in advanced directives because COVID-19 is likely to take them to a worsening of their condition that will result in the end of their life. So I hope that makes sense. It's not a bad idea to document what people want with COVID-19, but consider if that's really advanced care planning or if that's a conversation to have about just what your goals are. So in documenting these things, there's this challenge we talked about with signatures. So I just want us all to remember that if you have an idea of someone's wishes, even if they wrote it on a notebook or a napkin, if you have an idea of what they wanted, or if their healthcare agent has an idea, you should honor that. I think we all need to kind of get back to basics and not freak out so much about getting things signed and notarized, even though I understand if your organization requires that, yes, you need to do that. But remember, if you have an idea about the wishes, you need to honor those. Given physical distancing and in-person visit limitations, you're going to have to get creative with obtaining signatures right now. Some states have issued orders that waive or modify the rules around requirements that advanced directives need to be witnessed or notarized in person. If you can't get signatures, though, just get the wishes documented anyway. Verbal witnessing is something that might be permissible per your organization's policies. The best practice with that is to really carefully document the conversation with the witness and to note that verbal witnessing was provided and have the date of that discussion and the clinician's initial on that in your notes field or wherever you can put that, and some kind of detailed documentation. of phone calls. So, you know, every effort should be made to get signatures, but if you can't get them, don't not do advanced care planning. Just do the part that you can. And remember, with electronic signatures, that's really only an issue when the signature itself is electronic. There's never been an issue with scanning signed forms. When somebody's signing a form and then it becomes electronic, it's when the signature itself is electronic. And then the last shift we want to talk about is community outreach and education, which is rather extinct right now. No one's doing community events. The traditional outreach activities aren't happening. Everyone has figured out how to Zoom by now, and the good news is it works really well for virtual outreach events. And the benefits of that are that you can achieve a wider audience than when you're in a physical location. That's possible. There are less overhead costs, and you have easily available data to capture some meaningful metrics about what went on. Paul, you did Five Wishes did an interesting outreach initiative with a partner in California. Can you talk just a little bit about that? Again, another problem that we figured out with a partner?
We did, yeah, and this was on the earlier side of early in the summer. It was a hospice partner who contacted us and said, as a hospice organization, they were used to going out and doing community education at the senior center and in workplaces and in civic organizations. And they said, we can't do that right now, but we know we can Zoom, and can we work together to do a Five Wishes presentation to the community by Zoom? And it's been interesting because I've noticed that several of our commenters in the chat have said that they're doing this, which is fantastic. It's outstanding. And it's good to hear that that's happening organically. It just kind of naturally happened. And we've also been able to work with some of those partners to join in your presentation. So in several instances, I've joined into the Zoom call and done a walkthrough with Five Wishes. This one hospice organization had the idea to do a wish a week. So we actually had a cohort that started with us for 5 weeks. And at first, honestly, I wondered whether that was going to be too much. I thought, who would join this for 5 weeks in a row? But we had almost a bit of a family feel where we had the same 70 or 80 people joining each week. And it, in fact, was so popular that they added a 6th week so that we could talk more about what to do after you complete your 5 wishes. And that program now, I understand, is a finalist for a regional grant award to continue that same program with the community outreach with virtual Five Wishes presentations into 2021. So it was a neat innovation that we were happy to be a part of, that now I think, as you said, some of these things are not going to go back, but even if, please, God, I hope that we'll be able to do in-person presentations sooner rather than later. But one of the nice side effects of this outreach was that families were able to ask one another to join in this Zoom presentation, even if they were living in different states. So you had family members joining in with this hospice's community outreach, which was really effective. And a different hospice did something similar, but instead of targeting the community, they reached out to their providers, their referral sources. So rather than going in and doing a presentation in that physician group, the hospice invited the physician group to join the virtual presentation along with Five Wishes and deliver a similar message. So finding new ways over the hurdles is what we've been about in working with everyone.
That's great. Thanks for that. So yes, we've got new possibilities with community outreach and education, and I'm reading your comments in the chat box, and a lot of you are talking about what you've been doing with that, which is great. I want to really get into the details of those later. So remember, any questions or ideas or issues that you're dealing with, before we wrap up, just enter those into the chat box and hit send, and we'll have those in the record so we can follow up with you. And if you want to follow up directly about anything, here is our contact information. Joanne is the person, if you have any questions about the 5 Wishes on Demand that I spoke about any of the tools and resources that we've discussed, call Joanne. She's also kind of the whiz brain about the first stops for talking about challenges and obstacles that you're experiencing right now and ways that we might creatively solve them. So the little star by her name. And with that, we've reached our time. So I want to thank you all for your attention and pitch it back to Jennifer.
Great, thanks so much. Just a note that we did record the session, and we will have the archive available within 7 business days. And you may access the recorded archive by visiting the 5 Wishes Practice Community page at 5wishes.org/practice. Just look under webinars, and feel free to share the page and webinar link with your colleagues. On behalf of the 5 Wishes, thank you to both of our speakers, and of course, everyone for joining. Have a wonderful day, and you may now disconnect.